are in both, so they have to keep track of their markets. If they're insuring policies for groups with 100 or more, then they have to spend 85 cents. Now, I want you to think about percentages. I know you were told there'd be no math involved, but unfortunately we have to do that. You know, for example, sir, when you mentioned the 28% for individual, if you look at reports coming out of the Commissioner's office in Wisconsin, you're going to see that that's ballpark where a lot of the individual markets are running. The reason is, as a percentage, you have smaller amount of money, and the admin is to set up one policy. So there's premium coming in for one policy, as opposed to a group where I might have 10 people being set up, I might have 100, I might have 1,000. There's still the admin to set up policies for each record holder, but the point is that the percentage doesn't really do justice, and I'm going to get to the dirty little secret in a second. The Medicare is 1.5%, and again, percentage, you have to understand, Medicare claims costs are going to be 3 to 4 times an average cost. So I have to take that 1.5% and say that's the equivalent of 6%, anywhere from 5 to 6% admin, okay? And there's no profit, so this is the government administrator. It's cost plus, it's, that. But here's the part I want you to understand about PPACA, particularly on the group market, on the 100 plus. When you look at the equation that's set up, you've got 85% that's got to be paid out on every dollar that comes in. So what do you think trend might be for this year or next year? Trend meaning if we buy the same basket of goods and services, if I had a population of 1 million people, here's how many office visits they had, here's how many MRIs they had. If I take that same basket of goods and services and fast forward a year later, we're probably looking at anywhere from 6 to 8% increase. Okay. So if I ran at 85%, my claims costs are going to go up that 6%. My admin, okay, which is the 15 cents, can also go up by that much without getting refunded. Let me tell you, you can look to invest in the United Healthcares in the world in your 401k, because they will have a heck of a return under PPACA. And I don't support that. It's price control, but they're letting them get away with murder. Because they're not setting, here's how much per person, and then maybe this piece ought to be trended by CPI. To me, that would have been what I would have negotiated for a client. To say, okay, I understand the medical costs going up, but my third-party administrator is not going to get away with a 7% increase for admin. I'm going to hold them to 2 to 3%. But that's the piece where you look at this, and it's massive, and it's still not done. That's the part that drives me crazy. It's not done. It's hard for us to even debate it because a lot is, stay tuned.
Okay, got a bunch of folks here. I hope we get you all that.
I'm sorry, I couldn't address the piece on the training. I just want to say I'm not in a position to address on the training. I don't think it's a bad thing. I'd support more funds available for primary care because, yes, I've read many articles where there definitely will be a shortage.
Bill, can we respond to the question?
Wait, before you
Yeah.
answer, because a lot of us are saying we don't understand what he said.
Not a word of it.
Not a word.
We might as well have been agreed.
The two of them might have been having a conversation, but we all over here
Yeah.
didn't
We
know
have
what
Dr. Kraig
they
respond
talked
to that, so we have both sides
Yes,
respond to the
please.
same question.
Okay.
about. Please.
Now, again, that's fine because we've never done this before, so we're trying to kind of feel our way too. And you're saying that, hey, that's not quite complete.
No.
I'd like to hear another viewpoint.
Yeah, please.
Fair enough. Doctor, would you like to respond to that?
No,
Or, I'm
No,
sorry.
no,
Oh, I'm sorry.
Dr. Kraig.
Dr. Kraig.
Or Mike.
And then you want to summarize.
Too loud.
Oh,
Experts on the
Just
panel, not
Jeff.
politicians.
Let me try to
Speak up.
characterize.
let's see, you quoted from the Jonathan Gruber study some statistics to show that it will be more expensive, the Affordable Care Act, for some
For
people.
59% of the
For
individual.
people on the individual market, which are people who buy insurance on their own through the insurance industry, okay? So that was one. So you're saying people expect to get free health care, you pointed out, that
Oh,
on
I'd say
calls.
that's one ridiculous
And
expectation.
that they're not really going to, so it won't
Right.
match expectations. Then you had a discussion with the doctor here about administrative costs. And if I understand what you were saying that, that in the individual market, there is higher administrative costs because you're doing policy by policy as opposed
As
to.
when measured as a percentage, I think you
Right.
need to look at dollars per policy.
So there's that, and then you also said that since the medical loss ratio, which is the cap on insurance industry profits and overhead, that's not medical care. And just, I'll talk about it. Let me, it actually allows inflation, if you had a 6% increase in healthcare costs, you also get a 6% increase in the administrative part.
It allows-
20%
it
or the
allows-
50% part, and that's a very good deal for the insurance industry, and therefore that's a dirty little secret within the Affordable Care
It
Act.
allows it. It doesn't happen automatically. The carrier could certainly price lower, but it allows them to get away with murder.
Got it.
Like they are now.
So, I'll start with the Gruber study, and because I'll try to be quick until we get to other questions. You can see I have an op-ed in the Journal Sentinel a year ago, September, about Governor Walker's characterization of the Gruber study, which I considered misleading at the time. It's since been found to be false by PolitiFact, when he did a Washington Post column that used it this summer. The thing about, if you read the Gruber study yourself, you would find it's very positive about what the Affordable Care Act will do. It says 340,000 people more will be covered. It does say that some people will pay more in the short term, and the reason is this. Right now, and this relates back to administrative costs, right now, on the individual market, the insurance industry spends a lot of money to determine who they should cover and what they should charge. That's the administrative cost on the individual market. And so they sift through the population to find people who will be profitable, okay? So people who are getting individual market insurance now are considered a good risk by the insurance industry. So they might be a typical 28-year-old male, some of them, right, that are a good investment. Well, here's what happens. They pay more in the short term, some of them, the 59%, because now we're having a larger group of people who have a right to buy insurance. A lot of people have been denied coverage, discriminated against. So that's good for the whole, right? A lot of people who can't buy insurance now are allowed to buy it, right? But it's even good, I would say, for that person who's a good risk now, who gets a good purchase right now, because they will not always be a good risk. They will age, they will get pre-existing conditions, so it's not an apples-to-apples comparison. They are, in one case, they're buying something that will be taken away from them as soon as the insurance agency decides they're not a good risk for profit, right? And the other scenario, they get something you can never take away from them no matter what. So I would say that's worth a little more money, even if you do pay more. So but if you read the Gruber report, I think you would find it overall very positive support for the Affordable Care Act. As far as administrative costs, I agree, you could probably have a higher standard than 80% in the individual and small group market, that's small businesses, and 85% in large group. And that it could still raise costs a lot if there's high inflation. If there isn't, then of course there's less room to raise administrative costs. But right now, insurance companies have taken the same cut they took 10 years ago for double the premiums. We did a report on this at Citizen Action Wisconsin. So they have profited massively. In fact, there's a perverse incentive. The more premiums go up, the bigger a cut they get right now. So at least the Affordable Care Act starts to get us to a point where we are for the first time capping what is reasonable, what they can take as far as non-medical costs. Could we go further? Would I support us going further? Absolutely. The nonprofit provider-driven networks in Wisconsin, like Group Health Cooperative, Dean Care, and the like, they are all over 90% medical loss ratio, even up to 95%. So even a private nonprofit plan can get close to those Medicare levels.